Good morning.
The mass adoption of pets from shelters and rescue groups, combined with people spending more time at home with their pets, that's created a nationwide demand surge for veterinary care. And now some clinics are turning to curbside veterinary care visits. So explain to us why that might be.
Well, it's kind of a, like you said, kind of a 1-2 punch there. The demand for care has increased dramatically across the country, almost, or at least in small animal care. The other thing, of course, is with the pandemic, especially over the last few months as cases have surged, we've had staffing shortages where not just us but clinics across the country are losing technicians and assistants and doctors for 2 weeks or more at a time. So it's really has with the increased demand has really kind of compromised the ability to provide the care level that we are used to in the profession. And so we've had to make some adjustments and kind of limit exposure of staff. It's a little less efficient in some ways, but we also then don't have to go through and disinfect the entire exam room and waiting rooms and that type of thing. So it helps in some efficiency in other manners.
Now, if patients are using that curbside service, what are some things that they need to consider before their appointment?
Well, certainly, communication is kind of the big loser in this to some degree. We don't have as much face time with our clients to discuss, their concerns with the patients. So, we ask that, you at the appointment time, kind of list all your demands when you're booking the appointment. Not demands, but concerns, and then make a written list maybe of things you want to address specifically. Be sure you have cell phone handy. We try to come out and visit. Some practices don't, but in some of the weather we've had lately where it's cold and windy and rainy, it gets a little rushed standing out talking to you through your car window and that. So try to be understanding about the stress on staff and that, and work with us to keep the communications going as well as possible.
Now, you kind of touched on this a little bit, but this isn't your typical vet visit. So how can this make communication more difficult, and how can people maybe try to ease that?
Well, certainly, being understanding, it is kind of tough time for everybody. Everybody is stressed. Like I say, stay handy with cell phones. It's okay to go run an appointment during run an errand during the appointment if you need to, because sometimes it is going to take a little time. Sometimes if you really need something seen soon, drop-off appointments are going to be the best way to get those worked into what are kind of overwhelmed schedules at the offices. So.
All right, Dr. Gratton, thank you for joining us this morning. For more information about University Veterinary Care Center, head on over to universityvetcare.com.